Um, Recently, we have heard the news about the coronavirus outbreak in a central hospital in Almaty. This news is actually personal for me for two reasons. One of the reasons that I have graduated medical university in Almaty and have practiced my skills in the central hospital. The second personal meaning of this news is that my cousin, Almat Juvashev, was actually the head of this hospital, and he was shortly dismissed from his position after the outbreak started. And the local officials claim that the doctors were blameful for negligence, they were blamed for being careless with using their personal protective equipment and the masks. As a healthcare professional, right now I'm actually would like to share my opinion with our fellow Toastmasters, Madame Toastmaster, on the way this coronavirus outbreak has exposed some problems in our healthcare settings, in our healthcare community. So to do so, I would like to divide my speech into two parts. The coronavirus itself, its properties, what it makes dangerous, and why we are going through this pandemic. Another one is our healthcare settings, how it's been exposed by this outbreak. But before continuing, guys, I want you all relax, get relaxed. Today we have a marvelous weather, and let's have some mindfulness calm down exercise. I want you all close your eyes. Please, all of you, close your eyes. I can see you all, and follow my instruction. Please breathe in deeply through your nose and out through your mouth. Deep in, breathely through your nose and fully from your mouth. You can feel yourself relaxed, don't you? Now you can feel relaxed. At the same time, I have a news for you. You have already inhaled more than 1,000 microorganisms into your body. That includes microbes, viruses, fungi, but none of them will impact your health because they don't have the keys to enter your cells. And we all have some immunity from them. We have antibodies that protect our body from those microbes and viruses and put us safe from them. But how about this coronavirus? That pandemic of this infection throughout the world. It's actually novel. I can see, I bet, can you turn off your mic, please? Thank you very much. So it's novel, and none of us has antibodies against this coronavirus. And that means even if you're a healthy person without any sort of conditions behind you, you still can develop this disease. It can impact your health. Second thing about this coronavirus is that it's very contagious. There is some scale called R0 scale, which means how contagious the infection can be. If you check the flu, seasonal flu, its R0 is 1.3. For coronavirus is 2.0, which means every infected person with coronavirus will get infected to other person. If we are going to go through 20 iterations, millions of people can have been infected by this disease. So it's very contagious, but you don't have to take my words for that. I have some examples for that. If you check the United States, when they, in the New York State, had the outbreak of coronavirus, they were able to trace back one patient infection rate of the person who infected almost 20 people around him, including his family, friends, and neighbors. And even taxi driver who took that person to the hospital. What is more revealing that in South Korea, the 31st case, South Korean woman, she was linked to almost 2,000 cases after her. How it happens? When she developed the symptoms of the coronavirus, including temperature, the dry cough, she actually attended a church gathering. Afterwards, she went to the hospital, local hospital, and been checked with the doctors who recommended her to get through coronavirus testing. Despite this recommendation, she also attended the second meeting of the church. And afterwards, she's been admitted to the hospital. And the local authorities in South Korea, they discovered that almost 2,000 cases in the church alone were linked to that person. And almost 200 people, medical doctors, the patients who's been tested positive with coronavirus were also linked to that single woman. So you already can see that it's very contagious. The third, there is also scientific modeling of the coronavirus that being conducted in Finland. So they gathered around 30 scientists, including the epidemiologists, statisticians. They used the supercomputer to model how this coronavirus can spread. And what they found out that if the person goes to the food market or a small food store, if the person infected and coughs out or sneezes out the cloud of viruses, it will travel up to 5 meters, and there will be like the cloud of virus surrounding that person. And it can persist for up to 5 minutes, which means that if that person leaves their shop and you enter this shop without even having personal contact with any infected person, you still are susceptible to this virus. You may meet this virus cloud. So this one of the properties of this virus that make it dangerous. The second property is that it affects people differently. So we already know that some cases, some people do not have any kind of symptoms, but they still spread this virus. For instance, in the birthplace of this coronavirus outbreak in the Wuhan province, they were reported the family of 5 who's been contacted with virus. 4 of them developed the symptoms. They have this fever, the cough, they have been tested positive. The woman, the mother of this family, she didn't have any signs. Her lungs were clear, CT scan didn't show anything, but she still tested positive for coronavirus. That was alarm for the healthcare community. Second, we know the small island, Iceland, which is situated between Europe and North America. They have conducted mass testing to check for the coronavirus in their community. And by the end of March, they tested almost 1 out of 10 citizens to check this coronavirus. And what they found was staggering. Almost half of those who've been tested positive, they didn't have any symptoms. They didn't display any coughing, no temperature, no fever. What it provides us is information that the people can spread this disease without even knowing that, without being aware that they're spreading to the community. And that's why at the end of March and at the beginning of April, the Central of Disease Control in the United States and WHO World Health Organization has been changing their guidelines, recommending people to wear the masks. And not because we need to protect ourselves from this infection. Actually, vice versa, we need to protect others from ourselves. If we are carrying this deadly disease without symptoms, it's perhaps better to stop it within our scarf or any kind of mask, shield. So this is second property of this disease. The third one is that it's deadly because we know already from statistics, those who have the symptoms, around 20% of them require some hospital attention, and almost 5% of them need some intensive care treatment. So, so I can see the person. That people also require some attention from intensive care. And they end up developing the pneumonia or the inflammation of their lungs. The lungs will not function properly. And this special treatment required in the hospital. So this third property of the virus, it can develop pneumonia that requires medical attention and medical ventilators to help people combat this virus. And of course, we don't have any kind of treatment yet. We haven't discovered effective treatment against this virus. We don't have vaccines that help us to build the antibodies in our cells in order to combat this virus. So we all exposed to the virus itself. Now, let's switch to the healthcare field. I am myself been trained as a master. I did my master's in Emory University, United States of America, in a health policy and management field. Recently, I was leading the team in creating the healthcare program in Kazakhstan for 2025. So I've been studying a lot about our healthcare. I've been visiting the rural areas, the hospitals, and there are some information I would like to share with you. First of all, our healthcare system is severely underfunded. We have shortage of money pouring into the healthcare system. In fact, World Health Organization at the beginning of the century recommended all governments to spend at least 5% of GDP or global domestic product to the healthcare field. If you check the OECD countries, they spend almost 10% of their GDP to healthcare, up to 17% in the United States. Why do they spend so much? It means if you spend that much into the healthcare, it means you provide better access to the healthcare for the community. And also you can improve the quality of care. You can recruit the best professionals and talents to the healthcare field to save lives of those who've been exposed to the diseases, dangerous diseases, and deadly ones. That's why the WHO recommend put a lot of investment into healthcare field. How about Kazakhstan? Well, you won't be surprised perhaps that it's underfunded, but in terms of the numbers, in each year, we are spending almost less than 3%, guys, of GDP. It's almost twice as much as recommended number for the healthcare, which means right now we have healthcare facilities, almost 60% of them needs to be repaired, replaced, renewed in Kazakhstan, and it's before this pandemic happened. We need to, before that pandemic, we need to recruit this specialty doctors. We had a short supply of the anesthesiologists, the intensive care doctors and nurses in Kazakhstan. We've been already suffering from that. And those people actually in the leading edge, they're the ones that will help those patients to combat this disease, deadly disease, in intensive care units. So we already had deficits in our healthcare settings in terms of facilities, people. Another thing that we lack is an emergency preparedness plan. We don't have any kind of emergency preparedness plan for such deadly diseases. actually we don't have this national stockpile of masks or personal protective equipments, or the guidelines how to actually react, have like guidelines for the hospitals and the healthcare community to combat, to work in a single unit against these viruses. So we do have these problems in terms of this emergency preparedness plan. This is the second. The third one is related to our history. We inherited our healthcare system from the Soviet Union time. Some people believe we inherited one of the best healthcare systems. Others do not think so. I'm on the second camp because I know and believe that the healthcare system was good to prevent diseases, but for treating it had some problems. In order to show that, let me first give you an example of the best practices in the globe, in the world. If you go to any kind of country, especially in the OECD developed countries, they have the general hospitals, community hospitals, with all the wards inside of this hospital for treating the therapeutic patients, surgery, OBGYN, obstetrics and gynecology, and infected people. They have special rooms for them so that to prevent this infection spreading throughout the hospital. And why they put all these patients inside single hospital? It's because all of them require intensive care. All of them need some special attention from the cardiologists, anesthesiologists, and other specialists who can help within this single hospital. That's why it's better in terms of financial resources, in terms of the patient, to have the all access within the single hospital. Now, let's come back to Kazakhstan. What we have in our country. We inherited the hospitals that's been separated from each other, like infectious disease hospitals. They function separately from the general hospitals. If you go to our general hospital, usually you receive the services for the therapeutic or surgery, at least, but no infected people are allowed to be present there. Instead, you have to go and visit infectious hospital. What it means for us. In those hospitals, in these hospitals designed specifically for infectious people, we inherited from the Soviet Union time, they are not prepared to treat severe cases. They don't have access to the intensive care. They are lacking in ventilators, anesthesiologists. And we already know, perhaps you have heard from me that one of the cases that this coronavirus brings with it is that it leads to the pneumonia and the lung disease, lung inflammation, and those people need attention of those anesthesiologists in intensive care, where they can find it only in general hospitals. And now, with the onset of this coronavirus outbreak, we are in conundrum. How to treat these patients? Should we treat them in the general hospital, which is not being designed by default for infected people, or treat them in an infectious hospitals, which not by design do not serve well for those who need the special attention from the intensive care. That's why here's one of my claims that our structure do not help. The structure of healthcare settings will not help those severely affected patients. Another thing is that we in our country inherited the blame game. Some people try to blame others for the failure. The doctors has been infected because they didn't wear the protective masks. without conducting their good survey, I should say, yes. And we have such a culture of blaming others without considering what's the underlying structure that actually precipitated this spread of the virus in our community, in the healthcare settings, without understanding what sort of systematic measures we can do in order to improve it, in order to improve our fight against the coronavirus in our hospitals. And this leads to my conclusion. First, as you have learned, this virus is very deadly. It can spread very easily. None of us are protected from it. Second, the healthcare setting, we should not put pressure on the healthcare setting right now. That's why we need to follow official guidelines, especially young people who's listening right now with me, my speech. You'd better stay home and follow the official guidelines in order to avoid putting too much pressure in our healthcare system. The second thing is that in a long term, we need to invest in our healthcare system. We need to put the best practices into healthcare system, the transparency, the quality management, without putting blame on the person, because we already know if you remove the person, you will not remove the problem. It will proceed. We need to change the structure in a nearest future. Otherwise, when we get older, when we require the attention of intensive care of the physicians, we may not receive adequate treatment. On that note, I hope the breathing exercise help you all to stay calm within my speech. And I wish you all to be safe and sound. Over to you, Madame Toastmaster.